This lecture will be going over Chapter 1, Caring for Medical Surgical Patients in the MedSurg textbook. Licensed practical nurses, along with other healthcare team members, will promote and maintain health, prevent disease and disability, care for individuals during rehabilitation, and assist dying patients to maintain the best quality of life possible. Patients can have a single diagnosis of a medical or surgical condition, or they can have a combination of a medical and surgical diagnoses. This would be considered a comorbidity. LPNs have many exciting and evolving roles. Roles will include caregiver, educator, collaborator, advocate, leader, and delegator. Therapeutic communication and active listening are incorporated into every element of your care. An important aspect of nursing care is to show patients and families how to care for themselves or for their loved ones and prevent complications, restore health, and prevent further illness. Some examples of teaching would include reinforcing what the RN or provider advises regarding scheduling diagnostic tests, upcoming surgery, how to treat a wound, how to change a dressing, and also addressing the patient's concerns and questions. Some additional teaching activities would concern how to take prescribed medication, what side effects they need to report, and the self-care activities and lifestyle changes that would be required to promote rehabilitation and independence. You can contribute to the discharge plan by reinforcing discharge instructions and providing information to patients about community resources as well as self-help groups. You will assist in recognizing when a patient is experiencing complications and also intervene to maintain their safety. As a patient advocate, you will stand up for their rights and ensure that their needs are met. Advocating for a patient could be as simple as arranging for a special food or meals at times other than those within the facility's routine, or it could entail informing the healthcare provider of a patient concern. The most common leadership role for the LPN is in a long-term care facility. This would be like a nursing home. In this type of setting, the LPN can commonly assume the role of charge nurse. Many nurse practice acts will specifically state the LPN charge nurse in a nursing home functions under the general supervision of an RN. They would need to be available either on site or by phone. As a leader and a delegator, it's extremely important to know and understand which tasks can be delegated and which can be assigned to nursing assistants. In the LPN leadership context, delegation will involve transferring to the qualified UAP or unlicensed assistant personnel the responsibility to perform a selected nursing task or the activity in a selected patient situation that is within their job description. Some appropriate tasks that could be delegated would be the following. So maybe a task that frequently occurs in the daily care of patients, a task that would not require any nursing judgment to be exercised, a task that would not require any complex application of the nursing process, a task for which results are typically predictable and any potential risk is very minimal, and a task for which standard procedure needs to be used. Because a patient's condition can change so rapidly, judgment needs to be developed through experience as to what and when can be delegated. Always remember your 5 rights to ensure when you're delegating. You need to make sure that it's the right task. This task needs to be legally delegated for a specific patient. You need to make sure that it's the right circumstance. The patient needs to be stable, independent, and nursing judgment should not be required for the task. Any resources needed to perform this task need to be readily available. You need to make sure you have the right person. This means that the person you ask to perform this task is competent and, most importantly, qualified to do so. You need to make sure that you are giving the right direction and communication. This means stating the objective specifically, what needs to be done, when it needs to be done, and what they need to come back and tell you when they've finished. You also need to make sure that it's the right supervision and evaluation. This means that the delegating nurse would need to monitor the performance of the task. meaning that if you ask somebody to go check a temperature for you, you need to follow up and make sure they actually check that temperature. You need to be able to intervene when needed and evaluate the results of the tasks. You have to ensure proper documentation and also provide feedback to the unlicensed person. Therapeutic communication should always be used when communicating with staff, especially whenever making a request of someone. Be sure to address staff by name to gain their attention and explain the purpose of the communication. Explain the requirements of your request and offer a timeline for their completion. Obtain feedback that the request was understood, and again, when it is carried out. Be sure to express your appreciation for their cooperation and the work they completed. You are responsible for any care that you give or delegate to others. Tasks assigned must be verified to have been completed, and you need to make sure they were actually done properly and the care was documented. In today's medical atmosphere, hospital care involves high acuity patients. These are going to be very ill patients with complex needs that require a high level of nursing care. Each state's Nurse Practice Act will define the role and scope of the LPN. It is always your responsibility to be aware of the scope of practice in your state that you are employed. Be sure to follow your institution's guidelines and policies. The facility may more strictly limit the LPN's role than the state's Nurse Practice Act does, but no employer can ever give nurses permission to do more than their license allows. The National Association for Practical Nurse Education and Service and the National Federation of Licensed Practical Nurses are practical nursing associations that provide standards to guide the role of the LPN. On page 4, in box 1.2, you can also see some sites of possible employment for the LPN. In Health Professionals Education, A Bridge to Quality, the Institute of Medicine has identified the following 5 competencies. We need to provide patient-centered care, collaborate with the interdisciplinary healthcare team, implement evidence-based practice, use quality improvement in patient care, and use informatics in patient care. The Quality and Safety Education for Nurses, or QSIN initiative, also added safety as a separate competency to the IOM set. Patient-centered care means that the patient is a full partner in all decisions about their care. Collaboration with the interdisciplinary team would require open communication, mutual respect, and shared decision-making. The case manager will also strive to work with the ID team to provide quality and cost-effective services, as well as resources to provide a positive patient outcome. Evidence-based practice uses the best current evidence from research findings to make decisions about patient care. Evidence data are drawn from quality improvement practices, management initiatives, such as those from the Joint Commission, and professional organization standards. Nurses are expected to provide care based on scientific studies to ensure best practice. Nurses will use data from the completed interventions to monitor outcomes of the care delivered by various processes. Then they will use this resulting data to sign methods of quality improvement. Each accredited healthcare agency has a QI program in place that sets standards for care. Nursing units might have a QI committee or delegate nursing staff to do periodic audits of charts to determine whether standards of care are being upheld and to what extent compliance is occurring. The key components of informatics are communication, documentation, electronic data access, and data use. The electronic health record or the electronic medical record is the heart of informatics. Devices used for communication of patient information need to be approved by the facility in order to ensure secure data transfer. Every nurse needs to consider safety during every patient interaction. Patients are vulnerable to injury when they are ill or incapacitated in the hospital. Clear communication of patient data and clinical assessments is one area. Using the SBAR, or Situation, Background, Assessment, and Recommendation technique when communicating with other members of the team is one way to promote clarity and safety. It is vital that you prepare medications in a quiet atmosphere and use the 6 rights of medication administration as well as nursing responsibilities when you administer medication to patients. To ensure patient safety as well as your own, rigorously adhere to infection control guidelines at all times and use proper equipment and methods to lift and turn patients in order to avoid injuries. Biomedicine is the dominant health system in the United States, and it focuses on symptoms. The goal of biomedicine is to find the cause of disease and to eliminate or correct the problem. It does not emphasize prevention. Complementary and an alternative medicine, also known as CAM, will focus on assisting the body's own healing powers and restoring body balance. It's important to remember that natural medicines often have not undergone scientific studies to determine correct doses, side effects, or risk of interactions with other medications or food. Patients need to be reminded that with all herbal supplements, they need to include them when they're asked for a list of drugs that they take. Integrative medicine is a specialty that melds biomedical, complementary, and alternative approaches in treatment. The foundational principles include consideration of all factors that influence health, wellness, and disease, including mind, body, and spirit, the use of conventional and alternative methods to facilitate the body's innate healing response, appropriate consideration given to the use of less invasive and less harmful measures when possible, and addressing the whole person in addition to the disease. The concept that medicine is based on good science. It is inquiry-driven, and it is open to critical consideration of new paradigms. And healthcare is best provided as a partnership between the physician and the patient. Healthy People 2030 is a health promotion and disease prevention initiative by the U.S. Department of Health and Human Services. It is aimed at improving the health of people in the United States by promoting longer and healthier lives. It has 4 overarching goals. Number 1, attain a high-quality, longer life, free of preventable disease, injury, and premature death. Number 2, achieve health equity, eliminate disparities, and improve health of all groups. Number 3, create social and physical environments that promote good health for all. Number 4, promote quality of life, healthy development, and healthy behaviors across all life stages. You can model healthier lifestyles for your patients by not smoking, maintaining healthy eating habits, and exercising. It's helpful to understand a little bit about the payment methods because we want to keep cost containment in mind when we're delivering nursing care. Health insurance will spread the risk among a group of insured individuals. The young and healthy generally will not have as many claims for healthcare services compared to our older adult population. The fee structure is equivalent for all, meaning that the young and healthy will basically support the sick and older people covered by the same insurance provider. Retirees with chronic health problems and younger people not able to work traditionally have had difficulty obtaining health insurance. So in 1965, Medicare and Medicaid were created by the federal government to cover the needs of these groups. Today, Medicare and Medicaid fund the care for 58% of all hospitalized patients. The traditional method of financing healthcare services is the fee-for-service method. This involves direct reimbursement by an insurance company to a provider whose healthcare services are covered under a health insurance plan. To improve coverage of cost, the insurance provider will charge a deductible. This is a yearly amount that an insured person needs to spend out of pocket for healthcare services before the insurance provider will start to pay for all of the services. You typically will need to pay a co-payment, and there could be a co-insurance as well. Medicare is a federal public insurance program that helps to partially finance healthcare for everyone older than 65 years of age, including their spouses who have at least a 10-year or 40-quarter record in Medicare-covered employment, and who are also citizens or permanent residents of the United States. Coverage can also be extended to people younger than 65 years old with end-stage renal disease or who are permanently and totally disabled. Medicare A covers hospital and durable medical equipment expenses. Part B of Medicare covers out-of-hospital expenses. Medicare Part C involves managed care providers. Part D is the Medicare drug program that covers a portion of prescription expenses. The Medicaid program, which is funded jointly by federal and state governments, provides medical assistance for eligible families and individuals with low incomes and few resources. This program is meant to cover the population of people considered to be living below the federal poverty level. The goal is to have a mechanism for affordable insurance for those not covered by employers or those not able to purchase private insurance due to their healthcare circumstances or income. On page 8 in box 1.3, be sure to take a look at the basic components of Medicare. Take a look at Medicare Part A. Medicare Part A helps pay for inpatient hospital care, including drug supplies, laboratory tests, radiology, and the ICU. The driving force today in all healthcare facilities is cost containment. This means holding costs to within fixed limits while remaining competitive in the healthcare marketplace. The federal government first tried to stop the skyrocketing cost of healthcare by implementing a system called diagnosis-related groups, or DRGs. These are also known as illness groups. In this type of situation, the system will pay hospitals a flat rate for Medicare services, and hospitals will know in advance how much they're going to be reimbursed by the prospective payment system. Under the DRG system, the fee that the government will pay for hospitalization will depend on the DRG category, or basically the illness. Hospitals will receive a flat fee for each patient's DRG category, regardless of their length of stay in the hospital. Therefore, hospitals have an incentive to treat patients and discharge them as quickly as they possibly can. The facility can then keep the difference in payment as profit. Medicare will not cover specific preventable conditions of hospitalized patients. To prevent premature discharge, Medicare will also not cover the hospitalization or levy a fine if readmission occurs within a defined period. Another measure aimed at cost containment is capitation. This is an alternative to fee-for-service payment that involves a set monthly fee charged by the provider of the healthcare services for each member of the insurance group for a specific set of healthcare services. Managed care is a type of group health insurance developed to provide quality health care with cost and care use controls. This is accomplished by paying providers to care for groups of patients for a set capitation fee and by limiting their services. Medical necessity and the appropriateness of healthcare services are monitored by a use review system. Types of managed care systems would include healthcare maintenance organizations, or HMOs, and preferred provider organizations, or PPOs. This option is used by Medicare and private insurance companies. Holistic nursing care involves being aware of and attending to the physiologic, psychological, social, cultural, and spiritual needs of the patient. Assisting with bathing, feeding, ambulating, and other physical care will provide an opportunity to find out more about the dimensions of the patient's life beyond their physical problems. The focus of the nurse-patient relationship is on the patient's problems and needs. You need to be sure to maintain a therapeutic relationship when working with your patients, and avoid using that patient contact to meet any personal needs. For example, the need to be liked, the need for friendship, or the need for approval. A therapeutic nurse-patient relationship will end when the patient has completed their treatment or therapy. A patient who is physically ill is also affected emotionally by the illness or injury. Even patients whose primary illness is physical rather than psychological can sometimes express emotional discomfort through dependent, withdrawn, hostile, or manipulative behavior. They might act in ways that are confusing or uncomfortable for a nurse who's not prepared to act therapeutically. It's important not to take statements or behaviors personally, but objectively consider why the patient might be responding in this manner. It can be easier to deal with a patient's behavior if their responses to particular situations are understood. Appropriate nursing responses will require kindness, understanding, and sometimes firmness. Patients will appreciate having someone available to guide them through their ordeal in a therapeutic manner. The inability to assume personal responsibilities can be a source of worry for patients and can definitely interfere with a positive outcome after their illness or surgery. If a patient lives alone, pet care can be a concern. Conversing with patients in a therapeutic manner can help them identify these concerns and also begin problem solving. To develop a therapeutic relationship, trust needs to be established between the patient and the nurse. In today's healthcare system, time with the patient is limited, and each patient contact needs to be used efficiently. When going into a patient's room, explain how long you will be on duty. Inform the patient when to expect their meals to arrive and the approximate time that healthcare providers might visit. Explain what care will be given on the shift and when it will be offered. Many older patients are not accustomed to the informality of having strangers address them by their first name, so ask them how they would like to be addressed. An important part of the nurse-patient relationship is the ability to demonstrate empathy. An empathetic nurse will convey the interpretation of the patient's feelings back to the patient for validation and accuracy. Communicate at the level of the patient's understanding. Active listening will help the patient express their needs and feelings. Avoid judging the message or the patient. Make sure that the patient's and your verbal and nonverbal communication are congruent. Admit when you don't know something and find out the answer, and then deliver it as quickly as you can. Thank the patient for their cooperation and attention when appropriate. Avoid referring to a patient by their illness or diagnosis, and always refer to them by name. Allowing patients to perform what self-care they can and praising them for any effort with activities of daily living or their rehabilitation exercises will help rebuild their self-esteem. You can anticipate patients' pain control needs before they are expressed. For example, administer prescribed pain medication before painful procedures. After surgery, regularly assess for pain and medicate as needed per orders. Assess the need for further pain medication before the next dose is due and determine whether the medication is effective. If the pain medicine is not doing its job, you need to approach the healthcare provider and ask for a different change in the order. Be sure to ask if touch is okay, or touch an arm or a hand and watch the patient's reaction to see if that gesture is acceptable. Be aware of any cultural taboos about being touched. Avoid making judgments about people who are culturally different from you. You need to be open-minded and non-judgmental. You need to take differences at face value and accept people as they are while giving high-quality care. Transcultural nursing involves recognizing cultural diversity and delivering nursing care that is sensitive to the particular needs of the patient and family. To do this, you need to develop cultural competence. This can be done through knowledge of various cultures and by being sensitive to issues and preferences related to culture, race, gender, sexual orientation, social class, and economic situation. The philosophy of individual worth is the belief in the uniqueness and value of every human being. Nurses need to recognize that individuals have the right to live according to their own personal beliefs and values, as long as those beliefs and values don't interfere with the rights of others and are within the law. Profiling will ignore individual differences, and information about cultural groups can help explain but will not predict their individual behavior. Spirituality will incorporate the beliefs and values that provide strength, hope, and awareness of their sense of self. Examples of personal spiritual practices can include gardening, reading, inspirational books, listening to music, meditating, praying, communing with nature, practicing breathing techniques, volunteering, expressing gratitude, and counting blessings. Religion will attempt to formalize and ritualize spiritual beliefs. The value of patients' rituals and religious practices is determined by their faith and is not subject to scientific evidence. Spirituality, on the other hand, does not necessarily include religion. Crisis situations will often surface in the acute healthcare situation. Patients' beliefs and values can profoundly affect their response to their crises, their attitude towards treatment, and their rate of recovery. The need for spiritual care for patients and families might be intensified by hospitalization, pain experiences, chronic or incurable disease, terminal illness, or the death of a loved one. Treating each patient as a unique individual will require you to consider all aspects of their humanity, physiologic, psychological, spiritual, and cultural, and then incorporate that understanding into delivering individualized care.